Why is the site signature and delegation log so important? Not only does it list the staff members that the PI has authorized to participate in the trial, it also gives you a template of who you should look for when it comes to updating training. And that training requirement will be based on the task that they have been assigned to. So say, for instance, you have a study coordinator. Well, not all study coordinators might have the same tasks based on maybe their scope of practice. So if you are conducting let's just say a cancer study, and that cancer study involves starting an IV. If one of your study coordinators is a RN or LPN, and then a third one is a CMA or a non-certified or licensed person, their tasks will be different as it relates to starting the IV. Of course, that CMA, that certified medical assistant, and their tech will not be allowed to start an IV, even in clinical research. They still have to work within their scope of practice. So it's very important to pay attention to what individuals are assigned to based on their delegation log. And how do we know whether or not they are medically qualified? We look at their CV. That CV should list their education and their experience. And if they are required to have a license or certification, we need to make sure that that is up to date. Now, as far as a certification, there are some instances where people are medical assistants, but they're not certified. And so them not being certified doesn't prevent them from doing vital signs or EKGs, because these are things that a person can be trained on without having a certification. Even blood drawing in some states. But however, if they were calling in a medication, like for an or for SAE or AE, we have to see what their credentials are to make sure it's okay for them to call in that medication. And that priority also is within the parameters of the principal investigator. So who's ever the principal investigator, they are responsible for making sure that the people that they delegate tasks to are trained to do so, and it's within their scope of practice to do so. So that delegation law allows you to understand what documents you should be searching for as it pertains to training, and then whether you should review a CV or medical license to make sure that these documents are accurate. Another reason why we look at the delegation log to see who we need to grant access to. So if we have a person on the delegation log that has the task to perform the electronic data capture entries or EDC entries, we need to make sure that we grant that person access. So that's another reason why we looked at the delegation log, to see who we need to grant specific vendor access to. Another reason why we look at the delegation log, to look at handwriting. So if you are on a site that uses electronic TMS, or they chart in on the computer versus paper, you might have limited access to handwriting patterns. So it's important to always look at that delegation log to look for signatures, to see who has written what. Another thing about, not everybody's signature is legible. So we know sometimes the PI signature is not legible. So we want to compare that signature on specific progress notes or lab reports or AE sign assessments or physical exams. We want to compare that signature to that delegation log, because delegations log should have the individual's name in print and then their signature, so you can know which signature is associated with what person. So these are just some different ways that we understand that the delegation log is so important. In the comments, you add a way that you feel like the delegation log is important.